Hello everyone. Now in this video I will be discussing about the history taking of diarrhea. That means when a patient presents to the clinic with the chief complaint of diarrhea, what questions we have to ask and how to take a history. Okay, so let's start. So the first question we have to ask is, while at the start of the history taking, when a patient tells us that he or she has diarrhea, then we have to ask the patient, along with diarrhea, anything else that is bothering you, and for how long time you have been suffering from this condition, and how many stools do you pass in one day these days. Can you tell me when loose motions was started initially, then what was the frequency of loose motions at that time, and what is the amount of the stool each time, and the amount of stool, is it small or large, and ask the patient that about the consistency of the loose motions, that is the loose motions are watery or custard like, or is there any mucus or fat in the stools, are they difficult to flush, and is there any blood in the stool. Okay, and is anything special that aggravates or initiates the loose motions? Is there any relationship between food and loose motions? And is there anything special that helps in controlling the loose motions? Are the loose motions are persistent or intermittent? If the loose motions stop, then for how long time do you remain symptom free? And ask the patient if he or she has a vomiting or abdominal pain or fever, and ask the patient if they have used medications before diarrhea like laxatives or antibiotics for infection, and ask about the recent travel history, and ask if any family member and close relatives having the similar problem. Is there any history of diarrhea alternating with the constipation? And is there any sense of incomplete evacuation of the bowel after passing the stool? And do you feel a constant and strong urge to pass the stool? Any mouth ulcers and any problem with the eyes like redness? And do you have joint pains, any rash on your body? And ask the patient, is there any past history of radiation exposure, and he or she is suffering from a heat intolerance, and any tremors in your hands? Do you feel chest tightness and redness of the face? Do you have extramarital relations? And do you have cough and night sweats? And ask the patient if he or she have any contact with the TB person or someone at home having TB, and ask the patient if he or she is feeling numbness in the hands and feet, and ask about the bone pain if he or she is feeling the bone pain, and any history of fractures, and do you feel any difficulty in standing from a squatting position, and any bruises on your body, and have you have a disturbed vision, especially at night? Is there any history of unilateral lower limb swelling? And ask the patient if he or she is having diabetes or hypertension, and ask about the weight loss, and ask about the lumps. Do you have a lumps in your body, and any difficulty in breathing, and difficulty in swallowing, and currently the patient is using what medications they are taking for the loose motions. And ask the patients if he or she is taking the medications regularly or not, and ask about the smoking if he or she smokes, and ask about the alcohol if he or she drinks. Okay,